Dr. Seemab Shaikh is a pioneer and nationally recognized authority in the field of obstructive sleep apnea (OSA) and has a strong presence in national and international academics. He is the founder national president of the Indian Associations of Surgeons for Sleep Apnea (IASSA) and has also served as the scientific national president, reflecting his leadership in evidence-based and academic advancement of sleep medicine in India. Dr. Seemab has been an integral part of the team involved in formulating the Indian guidelines for the management of obstructive sleep apnea, contributing directly to the national standards of care. In recognition of his outstanding contributions, he was honored with the prestigious J.V. Disa Award at the 75th National All India Conference, a highly respected distinction. Currently, Dr. Seemab serves as the head of the ENT department at Namdar Hospital, Pune, where he leads advanced clinical research, practice, teaching, and innovation in ENT and sleep apnea surgery. We'll be going ahead and starting with the episode 1. The theme for the episode 1 is sleep apnea, what ENT clinicians must know in 2026.
Hello, my name is Dr. Seemab Shaikh. Thank you for having me here.
So let's start with the first question. The first question is, why is sleep apnea considered a public health epidemic rather than a niche sleep disorder?
Well, Ketki, good morning. Sleep apnea is considered a big health concern mainly because of its prevalence. People have now woken up to the fact that it's a huge disorder and it's a medical disorder. It's no longer a lifestyle issue that once upon a time it was thought. If you look at data across the globe, it's almost literally about 25% of people. That's literally 1 in 4. So in every room, if there are 4 people, 1 is definitely suffering from it. And we have Indian data that has come out a couple of years back from a very prestigious institute, the All India Institute. And they have pegged the Indian data at almost 34% plus. Now that is huge. That's literally like 1 in every 3. And that's the Indian data right now that we have. Of course, there will be a lot more data that needs to come out. But you can imagine that when you have such a huge prevalence of this disorder, and it impacts every part of your life and everything about your performance, as well as along with your issues related to diabetes, blood pressure, neurocognitive issues. This has a huge impact on the workforce of the country. It has a huge economic burden that comes in, and that's why people are actually waking up all across the world. So people don't really rely on or don't understand that sleep apnea is the one causing it until now, when we have started realizing that most of the other comorbidities that exist can be worsened because of this, and as a result you have a lot of economic burden to the entire country.
So now tell me, how is the ENT specialist role evolved beyond snoring surgery?
Yes, so you see, as ENTs, ENT as a branch has really expanded, and as ENTs, we are the ones who are really looking into the upper airway of the body. Now, what is snoring all about? Basically, what snoring tells us is the fact that somewhere in your air passage, there is some kind of a block. Otherwise, you won't get snoring. So the block is there, and that's why there's fluttering. So now you tell me, who better than an ENT surgeon who can evaluate you right from the nose down to the inlet of the lungs at the larynx level? Who better than an ENT to try and evaluate snoring? So because we as ENTs are the ones that deal with the upper airway, we are obviously more well informed if we get into the depths of the physiology, of the phenotypes that are happening. So it's not just about snoring, finding the obstruction. There's a lot of pathophysiology that is involved. And that's where ENTs have taken it as a huge subspecialty. And we are complementing the other clinicians. We are not doing it solely. We are complementing the other clinical branches to help establish a very good protocol of treatment for management of snoring.
So now tell me, what are the latest classification updates in sleep apnea, like OSA, CSA complex?
Yeah, so every disease needs to have a classification of some kind, so that when we are talking amongst clinicians across the world, we need to be on the same page. So sleep apnea is also classified into quite a few. So we have the obstructive variety, like I said, the one with the snoring is the obstructive variety. Then we have the central sleep apnea, which is where sometimes the signals and the respiratory centers from the brain are related, are having some issues. We also have a mixed sleep apnea. There's a lot of terminology it's a bit technical, but there's a lot of terminology coming in about COMISA, comorbidity induced sleep apneas. So, in effect, what we are trying to do is we are trying to slot different kinds of pathologies based on pathophysiologies, based on not just the anatomical problems, but also problems related to the rest of the body. So once we have a good classification, once we have all this in place, we are able to deal with this disorder in a much better way.
Sir, any red flags should ENT like focus on while an OPD?
So it's not just the ENTs, Ketki. Everybody should know about these red flags to focus. And one of the few, or rather the few big ones, are how you wake up in the morning. So if you've slept well, according to you, if you slept maybe even 8 hours or 10 hours at a stretch, and you do not wake up fresh, then that's a red flag firstly. Along with that, so when you don't wake up fresh, you've not had good sleep, and as a result, throughout the day, your functioning will not be at optimum levels. So if you have a daytime sleepiness issue, if you have a daytime lethargy issue, if you have issues where you're not able to concentrate at work, if you have issues where you're not able to, take clear decisions or your mind is foggy, if you have issues which relate to your other disorders not coming into control even though you are on medication. So all these kind of so-called quality of life issues. So eventually I could put it in just one simple statement of it affects your quality of life. So anything that you probe into deep as a clinician, when somebody is coming to you with recurrent headaches, when these are simple things. Why are you having the headaches? Have you not slept well? You need to probe into that. So these couple of things, if you probe into, you will probably not miss out on issues with sleep apnea. So not waking up fresh in the morning, early morning headaches, daytime sleepiness, lethargy through the day, and of course one other important factor is the endogenous depression. A lot of cases show up as endogenous depression, and if you do not probe deep into just their sleep quality related issues, you might probably miss this. Of course, snoring is something that everybody comes forward with now, they know, but that's just one of the symptoms of sleep apnea. It's not the whole gamut. So you have to probe deeper to be able to find out exactly whether you need to even diagnose this in a different manner.
Sir, what are the myths about sleep apnea that still persist among clinicians?
So one of the biggest myths, Ketki, is the fact that everybody relates sleep apnea and snoring to obesity or high weight gain. Everybody thinks that it's only the obese people or the overweight people who would be snoring, but that's something that you really need to bust that myth, because sleep apnea or obstructive sleep apnea has different components. It has a component which is related to what we would call as the static obstruction. So where, let's say, there are